So now we're in her esophagus on our way down to the stomach. And we're going to use most of this scope, and she's actually going to have to come closer, or we're going to move the scope closer to make it. So Dr. Dodman is just doing some water and some air to kind of just help facilitate passage. You're sticky. I don't want to go. Just dry. It's just because her mucous membrane right here is dry. So. And we're just coming in the stomach right now, so it's.
Is that where the holes bubbles?
Yeah, it's just for kind of coming down because she's been doing air the whole time.
Oh,
So
okay.
it helps kind of dilate the esophagus so that we can
Okay.
just kind of push it down. And so we're in her stomach, and so she's still adding air to something to kind of blow it up like a balloon so we can see the walls where we want to see. So let's look to the right more and then kind of. What you'll see is at the bottom, like if you kind of look at the bottom, like 4 o'clock, 5 o'clock, see it's real dark.
Mm-hmm.
That's normal. It's supposed to be dark like that. The dark red area on the bottom, horses make acid only on a portion of their stomach, so that's that bottom area.
Okay.
This area up here that looks kind of like that kind of smooth, pinky white sort of color,
Mm-hmm.
it's more or less like the bag portion of the stomach that helps us kind of for grinding and mixing.
Okay.
So what she's doing is putting the air in. You see how it's all kind of collapsed down there. We just want to push the walls back so we can kind of see a little bit better. But looking along that junction between that red area and the pink area is usually where we're going to see ulcers. Look up and right, please. And so that's the scope coming out of the bottom of the esophagus right there, the black thing.
Mm-hmm.
And those are ulcers right there. You see the red
Oh yeah.
sores, it looks like? Those are all ulcers.
Is that
So-
somewhat normal or is that not?
It's not normal. It's not uncommon,
Okay.
but it's not normal. Like
Yeah.
I don't go,
That, yeah.
oh, that's fine. They're supposed to have ulcers. No.
Well, I would say like for a horse who's only 2, is that
It-
On continue.
standard?
I would say that, I mean, she could have developed those in the last few days even.
Okay.
Those aren't super severe. I mean, it's localized to just this one area,
Okay.
which is why I look back here, because this is one of the most common places to see them initially.
Especially because she hasn't eaten for the past
Exactly, that's what I was just going to say. Being colicky, stressed, and off food for the last 2 days, horses can develop ulcers in just a couple of days.
Okay.
So you can see how they just kind of look thin. You know, they're not like the walls around them aren't kind of built up like a volcano. You don't see like a lot of scarring around it. So I think those are probably fresher ulcers. So I'm going to kind of follow back around to the left there and we'll see if we see any more. But I mean, I'm done in the fact that we know the answer is that one, she's got an empty stomach, so she doesn't have enough a feed impaction here.
Mm-hmm.
And then secondly, she has ulcers, so we're going to put her on some ulcer medication to help make her stomach not burn. You see they're kind of coming over there, see that right there?
Yeah.
Don't blow your nose on everybody.